All right, we are officially going to get started this morning. And thank you again for everybody joining this session. This is one of many that we are going to be doing for our members. I wanted to give a little bit of background on how this kind of came about. Maybe 2 or 3 weeks ago, James Constant from the Beacon Council reached out to me. The Beacon Council was contacted by the mayor of Miami-Dade County, was looking to create industry task force for hospitality, retail, manufacturing, obviously, on really how to get businesses reopened in Miami-Dade County. And manufacturing is a little different because, many of our manufacturers weren't necessarily closed. They may have been at reduced capacity, reduced staff. Some, if they, were in the supply chain of these critical needs or retooled their facilities to produce some of these critical needed things for personal protective equipment, hand sanitizers, and the like, they were extremely busy, and some actually had to close. So manufacturing is a little bit different in that regard, but a group of 8 of us, and myself and Jay, so there were 10 plus our parts from the Beacon Council and a few of the county officials, started to develop some guidelines. And they were developed really, and I'll give the premise here, it's important. They were developed, the mayor said, go under the premise that everybody has COVID. Just do that, everyone has COVID, be direct, give me guidelines that are going to essentially be the least restrictive possible to get people back to work as quickly as possible, but at the same time, keep everybody safe. So it was a challenge to do that because manufacturing, obviously not every manufacturer is the same. Some have to follow GMP guidelines. Some do follow it. Some don't follow it. There's different verticals in manufacturing. So it was a little challenging in some regards. But, we created these guidelines really applicable to all manufacturers. The majority of manufacturing, not only in South Florida, but the state is really less than 50 employees. So we had some of our task force members that were small manufacturers, medium, just large size manufacturers, some that followed GMP guidelines, some that had to for various reasons. So we really developed these, how to get manufacturers that are not open to a point where they can open again from a safety issue. How do we get folks that have to bring workforce back to be safe, and how to keep those that have been operational at capacity safe. So one last disclaimer is that, when we were developing these recommendations, we also had to have blessings from doctors. So there were a couple doctors from some of the healthcare systems that, had to give the mayor their feedback that, yes, these recommendations, are good from a safety aspect, from a health aspect, and they were okay with it. So, last Tuesday, we presented to the mayor our final set of recommendations, and he has those, and he is going to be getting all the recommendations from all the industries, and he's going to be publishing something that he thinks is applicable to Miami-Dade County. So these are what have been presented, and I'm going to show here a little bit what we have. And for purposes of today, everybody on the call will get the full set of what we provided. I'm going to show kind of a skeleton outline of what these guidelines and recommendations are. But before I do that, I want to thank a few folks here. Some are not with us, some are, but the companies that were involved in developing and taking the time, and there was probably close to 40 hours or more on this collectively as a group, but a lot of time was spent. So thank you to Concept 2 Cosmetics, Diplast Products, Dematech, Filthy Foods, Novin Pharmaceuticals, Peel Developments, Tucci, and Vista Color. So those were the companies that were involved in, and 6 of them are on the panel this morning. And the panel is going to be an interpretation, an application, and best practices of the guidelines that were created. So we've broken those up into 3 different panel sessions. After each panel session, our moderator, James Constant from the Beacon Council, will be fielding questions. So if you have questions, please use the chat feature to type in your question. Caitlin Santondi from our office and member services, she's going to be fielding those questions, and she'll be asking them of either a certain panel member or to whoever's on the panel. At the end of the panel session, we'll still have some time to have other questions that may have not been answered or that come up at that particular time. So we are going to do our best to end. We always like to start on time and end on time, be respectful of everyone's time, taking the opportunity to be on with us. But we'll end at the time, so 10 o'clock. If your question, for whatever reason, is not answered, either we have to reach out to somebody else or it just didn't fit within the time frame, we will have that question answered. And we will send the response back to you personally in writing. So your question will not go unanswered. I promise you that. And what we've got today is really, and we'll touch on it a little bit at the end, but it's really a introduction or the first part of something that Jay Hespenfleur makes, myself, are working on. It's really a phased-in recovery plan for our manufacturers and our members. So this is really the start of it. We had something yesterday about what happens when one of your customers goes bankrupt. What do you do? But today is really the first phase of, and really following. Governor DeSantis has a phased-in approach as well. So we're trying to be cognizant of that and get you all, recovered as best as possible. But this is really the first start of that. And the goal today is really for you to hear from the panelists. On the first session of the panelists, it's an interpretation. You're going to hear from some companies and then application and then best practices from two of our members. So it's really exciting. I thank all the panelists for taking time again to be with us. We've become this tight-knit family here, developing these guidelines and so forth. And our moderator, James Constant for the Beacon Council, thank you for taking time and doing this for us. Great partner of ours from the Miami-Dade Beacon Council. And I'm going to provide control here to James, who's going to start us off. So James, the time is yours, sir. Thank you. Oh, by the way, James, before we start, I'm sorry. For the group here, these were the buckets of guidelines that were created. Again, it's a skeleton outline just to give you an idea, and you'll see this throughout the webinar today. I'll show this at certain intervals, but these were the areas that we focused on: building access and safety, building preparation, social distancing, communication, staff procedures and protocols, and then testing and traceability. So this is a skeleton outline. You all will get the full set of guidelines that were created. We will send that to everybody that joined us this morning. So James, we'll turn it to you.
Great. Matthew and Jay, thank you so much for having me, and to all of our panelists and participants calling in today. Know this has been a difficult couple weeks. Some of you have been forced to possibly close or limit operations. Some are still going strong. Obviously, our economy is facing some of these impacts, and certain sectors have been hit more than others. But we're optimistic that we are starting to get on the right side of the curve, if you will. And part of this conversation is really how we move into this next phase beyond just business continuity, but to recovery. I have to say it's been a pleasure working with this manufacturing group. You guys are much more detailed and organized than I understand some of the other groups, so it was a real pleasure. We dug in a couple long days, nights, even weekends, putting these recommendations together. And I think it was a very solid process. Just a quick background, if you're not familiar with the Beacon Council, we are the economic development agency for Miami-Dade County. We work closely with our partners in Broward, the Greater Fort Lauderdale Alliance, Palm Beach Development Board, our sister organizations across South Florida. And really our charge is to help diversify industry in Miami and help create jobs. So for myself, it's particularly difficult seeing what's happening right now in our economy, where we're focused on job creation, and you see the cliff, if you will, of unemployment and job loss. But there are some bright spots, certainly. We'll hear from Louis at Dematec, who's in the position maybe of looking to even expand some operations. We have had the opportunity to continue to assist companies through these last few weeks, and not just the companies that are struggling, but there are companies that are making new commitments to grow, to relocate to Miami. And our pipeline, amazingly, still remains strong. So despite a lot of the difficult stories out there, we are still optimistic. Over the last few weeks, what we have been involved in from a Beacon Council perspective, those first few days, obviously very challenging, trying to understand how this is impacting our small business community. We set up a new web portal called bizhelp.miami. That's B-I-Z, help.miami. And the purpose there was to help companies that were maybe not familiar with the process, how to access the SBA programs, the disaster loan program, the state of Florida bridge loan program when that was available a few weeks back. And then of course the federal PPP program, which is I think just winding down now, its second phase, and there may be future phases. In addition, we built out a lot of other content about support for businesses, be it grants at the city. We've pulled together a number of professional service organizations that are offering pro bono work if you need some tax insight or support, if a company needs an immigration attorney, whatever. There are folks that are listed on that site that are there to assist. So for you or for some of your partners and clients, I recommend you take a look at that. The second phase was what we engaged with this manufacturing group and others. As Matthew mentioned, the mayor set up a whole number of committees to put together these guidelines for reopening. So the first, of course, that's already been rolled out was the open spaces, our parks, our marinas. We dug in on manufacturing. There was another group on hotels, on restaurants and retail, on entertainment locations, office spaces. And as I said, it was a pleasure working with this group because I know that some of the restaurant conversations have been quite challenging. Of course, when you're welcoming in a whole lot of public into your space, very difficult to manage. So the next phase for us, we're looking right into recovery. We're having some deep conversations now about new marketing campaigns for Miami-Dade County, new funding sources, kind of refreshing our programmatic efforts, how we recruit business, how we support business here. So again, we're optimistic. We're dare I say, excited about how the recovery can look here. Understanding there's still some time before we get there, and some major hurdles on testing and vaccines and others before we can really see a full recovery. So with that, I want to move right into the program. Today, we're going to have kind of three different parts to the program, if you will, talking about these guidelines that, again, these are our recommendations to the mayor's office. What is currently happening right now, all those committees have submitted their recommendations. The mayor's office is going through those, getting feedback from the healthcare and medical professionals. And then in the coming days, no time certain yet, they'll be rolling out broad guidelines for all of us as we move into that reopening phase. So the three sections today are going to be the interpretation of the guidelines, the application, and then we'll hear about some best practices in that. As we have these presentations from our panelists, we'll break after each section for a little bit of Q&A. And I think we all agree that as much as we want to hear from the panelists, we really want to also get your questions and get into the meat of what the participants want to have answered. So with that, we'll move right into the part one, interpretation of the guidelines. And I'll introduce our two panelists here. We have Andrea Cid. She is the managing director of Concept 2. It's a plant-based cosmetics company. Really excited to hear more about what they're doing. I understand that they've had to actually suspend operations a little bit in this process, but are quickly looking to reopen. And then Luis Agüero, who is the president of Demitec, a great life science company in the Miami Lakes area, I believe. And they have some exciting plans, as I mentioned, to potentially even expand in what could be a new opportunity of mask manufacturing for PPE. So with that, I'll turn it over to Andrea and Luis to take it away in section one of our.
Thank you for that introduction. I just want to say, first of all, thank you to Matt, Jay, and everybody on the committee. It's really been extraordinary how people have come together to hear all of our concerns. And these past few weeks have been really, really rough. We had to give you some context, Concept 2, we specialize in bath and body products. And it's particularly in perfume. 90% of what we produce in Doral is exported. So our clients shut down basically around the world, and there was nowhere to go. So we quickly realized that before anything was demanded or stated through our local governments, that one, we needed to start to put into place safety guidelines, and two, eventually that the best thing that we could do for the company to try to reactivate at some later point would be to shut down. So at the moment, we've been shut down for about 5 weeks. So you can imagine that that's been extremely challenging for all of our staff. We're also a small company, and we're under 20 full-time employees. So when we approached the guidelines, first of all, really concentrating on what the CDC is saying, and as Matt was mentioning, not just what we were being told locally, but because there's a lot of confusion on information, and we know that that's been the case for everyone. But really having these guidelines vetted by doctors. There was a doctor from University of Miami, as well as a Department of Health doctor, that went through these. So it wasn't just ideas that made sense. A lot of these are very common sense ideas, but that they were actually vetted as to being effective in our environments that will be able to be implemented. Because again, it doesn't help if we can't actually implement things, and if our workers aren't going to be able to follow things in a way that that will actually have an impact. And to that effect, I would say that the guidelines, distancing, the physical distancing, masks, eliminating touch points, all of these things were looked at from a point of view of not being super prescriptive or restrictive, but of having something that we as business leaders can actually implement in our spaces to make sure that we are keeping our workers as safe as possible. So I really am quite pleased with how very specific our guidelines are, and that, yes, they can be implemented, whether you're the big company with over 200 people, as we have some of the panelists have been doing that, or people like us, where companies like us, that we're under 20 employees. And so we can still do things like making sure, during break areas, making sure that everyone is participating, every employee is participating in following all of these guidelines and contributing to that process.
Hi, everybody. Luis Arguello, I'm the president of Demetec. We're a manufacturer of surgical sutures based in Miami-Dade. We've been in business for a little bit around 20 years now. Our products are being distributed, sold in over 100 countries throughout the world. Our market is the operating room. Having said that, with this crisis of COVID-19, an opportunity has been presented to Demetec to get into the mass business, since we already have the distribution network worldwide. We're not thinking of manufacturing masks only during this time of crisis, as the crisis will be over within a year or something like that. But we are thinking that once that we have established the manufacturing process, we will be a big player worldwide in the mass supplying operating room theater throughout the world, because we already have the distribution network. Our distributors have been asking us since this crisis started to supply them this product. We didn't have it. So now, thanks to the assistance and help and guidance of JS and Matthew Rocco, We have put a lot of hours and a lot of efforts into the creation of this new facility for Demetec that hopefully will bring a little bit over 200 jobs into Dade County. Having said that, when the crisis started, our first thought was how to protect our plant, how to protect our employees, to be able to continue operating our manufacturing plant, and try to avoid having any of our employees get contagious, as that situation will close our facilities. So we gave a lot of thought, and being part of this panel, we developed some procedures. I would also like to thank Jay Hernandez from Vista Color, as the documentation and guidance that he gave us at the beginning of this process have been very useful, and I believe we have followed his guideline. So I wanted to thank Jess Hernandez for this. Having said this, safety for our employees and smooth continuation of a working environment within good manufacturing practices. I have to say we are FDA monitored, and thus we have to follow FDA 21 CFR, which is very strict, which has very strict procedures for us. So we have more challenges than a normal manufacturing process. We have made some guidelines, and for this, manager of quality, she is the one that has developed these guidelines and procedures and is implementing. So I would like to pass this now to Tracy. Tracy, please come in.
Good morning. My name is Tracy Chadrick. I'm the Director of Quality Assurance at Demetec Corporation. And as Louis mentioned, we have implemented procedures to ensure that the plant not only manufactures under good manufacturing processes, but that we were safe. We were safe for the business as well as for our employees. So we did implement many of the processes that were outlined in the guidance documents, and basically controlling our access, social distancing, the employee screening, the visitor screening, the staggered work times. We're making sure that our breaks are with small groups. We're ensuring that our employees are wearing their face masks throughout the building. We have the option of gloves. We've implemented lots of sanitation procedures to ensure that we keep our employees safe. I think the biggest challenge in this process was changing the mindsets of the employees, because we had them in two extremes. We have the people who feel like, I'm coming to work every day, I'm going to bring COVID home to my family, and those people who feel like COVID doesn't exist. So we have to balance that with people to ensure that they are following the guidelines, maintaining the social distancing, and making sure that we're sanitizing on a frequent basis, wiping desks down, washing hands, wiping down doorknobs. So it's been a challenge in making sure that we could have a meeting of the minds with all of our employees and kind of policing them so that we can change, because this is no longer, the way our business operates has changed, and I think it's going to be that way for a while. So it takes a little bit of some time for people to change their mindset, but we are definitely on the right track with that.
Would you like us to go through some procedures, Mac?
You know what, Luis? I think let's move to the question and answers, and then if some people have some questions on the procedures, we can have you talk then, or we can also send them out to the group as well. Luis, just in the essence of time.
Hi, Matt. Currently, there are no questions in the chat.
Okay.
Oh, here we got one.
I see.
Okay, good.
We do one question come in. How were you able to ensure social distancing at all times?
I'll take this. I'm not sure how big your facility is, Wendy. We're fairly small, so this is obviously easier for us to do than for a 200% company. But in addition, we're hopefully starting to going back to work next week.
Yeah, I'm sorry, it's Wendy, yeah.
Hi.
The question really isn't about the physical social distancing, it's the mentality of the social distancing. And I was curious how the last speaker was able to overcome some of the issues that you talked about, where some people didn't believe it existed, other people were afraid they were going to bring it home, because some of our challenges isn't the spacing, we've got the space, is that during breaks people are still sitting together and sharing food, and they're walking together in the parking lots outside.
I understand your issue. This is Tracy again. And
Thank
yes,
you.
we're seeing the same issue. So it's, again, we walk through the building, and I'll walk through the building and just spread my arms out. And I'm reminding them, listen, we need to be about 6 feet apart. Guys, remember, spread your arms out. Let's be at this distance apart. We've limited our teams work at, our employees work in teams. So what we've done is, for break times, those are staggered, and we have 6 feet marked off in the break rooms, for the bathrooms. We've limited the number of people that can go into our multi-stall bathrooms. So again, it's just a constant reminder. We've put signs up, but you know, as I said, we're kind of policing, and you know, people fall into their old habits quite frequently. So it's up to the people who are more vigilant to remind those people who forget regularly.
Yeah, one thing we've done that I think helped a lot with that, and again, we're smaller, but every single person in our facility, what we did is, when we did the schedule of the cleaning and the wiping down of the high touch areas, we're doing that 3 times a shift. And based on how our schedules of our shift is. Every single person, we had a sign-up sheet, we had a list of all of the touch points that needed to be cleaned, and every single person, even the people in the office, were going to be doing that. So and that, I think, fostered a sense of, this isn't someone else's problem. Like, normally we wouldn't have thought, we have a cleaning staff and they take care of the cleaning. No, this is everybody. Everybody is going to have to think now about every single place that they're putting their hands, washing their hands, figuring it out. Things we never even considered before, when we open doors, when we close doors. And if you're there, you're part of that process, you're part of that enforcement, then I think it does help a bit, rather than just kind of relegating it to somebody else. Every single person in our facility has a responsibility now related to following these guidelines.
Thank you.
Thank you for the question. I think Andrea makes a point that we discussed in some detail in this process, was the employee responsibility, that it really, you know, you can write these guidelines, the mayor on down to, you know, the person managing the small team can put out these guidelines, but if every single person is not taking their own personal responsibility in ensuring the social distancing or wearing the mask, it's, you know, the whole thing falls apart. One of the things that I think this came from Hess Hernandez, and we'll be hearing from him later in the best practices, but we talked about even updating the employee handbook, and you see that in the communications area for best practices, or even suggesting that all staff sign some type of commitment letter, if you will, to, you know, to some of these basic practices. So it's not just, you know, hey, here are the rules up on the wall, or, you know, you communicate them in a staff meeting, but each person is, you know, signing off on their little contract, if you will. Things like that instill that level of personal responsibility, I think will help get you closer to that point.
And James, I had a question from somebody that emailed me or sent in the chat. If anyone's wondering if the slides that you're seeing today will be published, we will also send those to everybody after the call as well, so you can see what was in here. Also, someone else mentioned, for those that may be having a hard time seeing, in particular, this screen that's there, if you you know, fit your zoom there to 100% or fit it to the window, you should be able to see it a little bit more enlarged version of the wording in there. So if anyone's wondering that, go ahead and do that.
I have one more question, Andrea. As you've been kind of forced to shut down operation, what are you seeing? What are the benchmarks or the goalposts that you're seeing that you need to get to before you can be fully operational? Again, what are those considerations in very general terms?
Wow.
What are you tracking
really,
to make
that's
that
really
decision?
hard. Yeah,
Okay.
I mean, that's really hard because we're working in such an uncertain environment. So of course, there's the health. I would put these into two kind of buckets that I've been thinking about. There's the health concerns. So are we getting testing up and running? And yes, testing is not where it should be, but it is improved. I actually managed to get an antibody test yesterday done, and that process at least exists. It's not mass available to everyone for free yet, as well it should be at some point, but at least there is a process for, and something is better than nothing. So I'm seeing that trend improve, as well as I'm seeing my clients start to, around the world. The Middle East is a huge market for us, and they were completely shut down. They were in serious lockdown, and completely like nothing was working, and they're starting to reopen with similar guidelines to what we're seeing here. So as I'm seeing some of that come back, as I'm seeing our supply chain start to function better, it's not great, but it's not where it was before. So many assumptions that I used to be able to not even think about. Of course, we can get caps. Of course, we can get bottles. Of course, all these things. It's solving one problem after another and just putting one step in front of the other, and that's all we can do. So in terms of, yeah, I mean, I would love to have like, okay, we'll be able to do X when this happens, but there is so much uncertainty and so much change happening on a daily basis that it's just really one step at a time.
Great.
And
Well, thank you. So certainly a lot of uncertainty out there. Yes, Matthew.
And before we move on to the next panel, one question I received yesterday, so if anybody's asking, so were these recommendations and guidelines only developed for Miami-Dade companies? No, I mean, they were because the mayor asked us to do for Dade County, but these are designed to be applicable to all of our members. So if anyone's wondering that, these are not only Miami-Dade County manufacturing guidelines that only can be used by companies in Dade County. These are available to our members. So. And then also for the folks on the line, if you think of any questions after we move past this panel, use the chat feature and we'll get your question at the end.
Exactly. So we're going to move on to the next section. Again, if you have further questions for Andrea or Luis or Tracy, please hold those to the end. But our next section is the application of the guidelines. And we're going to be hearing from Daniel and Charlie of Filthy Foods. I've had the pleasure of knowing Daniel for, I think it's been a couple years now. And as soon as you get familiar with Filthy Foods and their product, you will never again order a dirty martini. You'll be ordering a filthy martini, and you'll thank him for it after. So with that, give it over to Daniel and Charlie to give some opening comments.
Thank you, James. Thank you, Matthew, and everybody involved. My name is Daniel Singer. I'm the founder and CEO of Filthy Food. We make cocktail garnishes, so primarily olives and cherries for the bar, restaurant, and hotel industry. You can tell from my accent that I'm not from Miami originally, but I'm incredibly proud to be part of this community. I came to the US in pursuit of the American dream. We built our business, probably like many of you, out of the back of our cars, on subway trains in New York, going from bar to bar, presenting our products to people, and they told their friends. And so before all of this happened, we were in some of the best bars and restaurants, hotels in the world. So our industry has completely been devastated. Hospitality, no bars, restaurants, or hotels are open. We had a huge amount of business with the cruise ships. So we've really spent a lot of time determining where we can pivot more into D2C, how we can get our products out to consumers. So we've totally taken a different tact. From a leadership standpoint, I'm going to hand over to Charlie Hart in a minute, who's our COO. But from a leadership standpoint, it's really not just been a time to evaluate our business, but also a really important time to evaluate your people. I mean, ultimately, one of the questions before was, what if people aren't respecting social distancing and those types of things? I think you're going to have an opportunity to evaluate everybody that worked for you, and you're probably going to realize that a lot of the people that got you this far may not be able to take you forward. They may just not be the right people to take you forward. They may not have the right mentality to take you forward. And so one of the pieces of advice I would give is, we spent a lot of time as we were scaling the business, going from, as I mentioned, back of our cars and delivering it in that way. As we started to scale, it was really about making sure that we had the right people on the team with you. So we are a GMP company, and so we brought in Charlie Hart. Charlie Hart is our COO. Charlie has a huge amount of experience in food manufacturing. In the past, we had come from the meat industry, which has a totally different type of levels of bacteria consideration. You have airborne bacteria like Listeria and other things like that. So we were already quite familiar with masks and gloves and those types of practices. Our business is acidified foods, so it's slightly different levels of consideration, but still in the food industry, we already had a lot of the considerations in place with regards to sanitation, hand washing, things on the floor that you have to walk through to make sure that your shoes aren't carrying bacteria. So again, just before I hand over to Charlie, just want to say, ultimately, it's been great to be part of this panel, really to feel part of the community. And I just want to wish all of you in manufacturing best of luck navigating these new times. Good luck, everybody. I'm going to hand over to Charlie Hart.
Hey, good morning, everybody. So I'm going to discuss with you guys a little system that we put together at Filthy Foods called the 3S principle. None of this, obviously, there's a playbook for nothing that we're going through right now. So all that we did at Filthy, as we're already under the FDA umbrella, is to try to enhance what we're doing, try to have a little bit of foresight, how we can make things better underneath the current conditions that we're already operating in. So what I'm looking to do today is to give you guys a quick brief on some of the ways that we currently operate, and then some of the things that we've enhanced, and some of the things that we're looking to do down the road. And our goal is to share this with you. Some of it may be helpful, some of it may not at all or apply to your business, but nonetheless, hopefully it'll jog some thinking. So the 3S principle, like I said, we just came up with that out of thin air. We call it separation, sanitation, and safety. The safety portion is mostly personnel safety, but it can lead itself into whatever practice you decide to draw up and put in front of your team. Before I get started on the 3S, the biggest things is that companies, for me, companies need to write these things into their handbook. They need to write it into their practices, or it doesn't exist for me. And I think that's one thing that owners and operators need to take responsibility of in their own business, is to not just think in theory what they're going to do, but actually write it down and practice it. So that was one of the first things that we did, was to analyze our threats and our risks and put it into writing. And then we wrote that into our handbook and into our GMPs, and then eventually had meetings with our employees so that we could get them to get the buy-in and sign off. And that just gave us a little bit of backing that we could show anybody that came and looked at us or audited us that not only do we have it in theory and in practice, our employees have also signed off on it. I think that was really important. So as we get into the first S, which is separation, you know, a lot of companies have punch clocks. We thought we were doing better, being more futuristic at Filthy, having a biometric fingerprint clock. So what we're doing now, since we have that biometric, is we're utilizing somebody there to sanitize between the employees so that there's no finger contamination on the clock. We also have, like everybody does, we have manufacturing employees as well as we have office personnel. So we have both of those groups entering in different doorways. Our belief at Filthy Foods is that it will be impossible for the short-term being for us to completely test or control anybody. So our approach, even though we are practicing social distancing and everything that you read and see in the news, our approach is very different in a way that we're counting on people having it, and we're just trying not to spread it if it were to happen at our facility. So we're segregating entrances so that if we realize that an employee is infected, they need to go home, at least we've separated the herd a little bit. So separate entrances is really important. We've started to put up curtains and even temporary walls between our different production lines to try to segregate people from commingling. I think most of you guys probably have some of the same questions I do, and that's how do you manufacture when people need to work next to each other, when you're passing a tray or a product from one employee to the next. I don't think you can stop that, otherwise you're going to stop your business. So I think the more important part is starting to really analyze what that threat or risk is and start intensifying the cleanliness or the sanitation that comes along with that piece. Or if that piece is something that's going to be transferred among employees, maybe you want to have it disposable. You might want to make sure that it's completely free and clear of any possibility of contamination or holding anything. Another thing that we started working on too was, and it was mentioned before, staggering employee breaks and lunches. We've gone as far as we have the luxury where we might have, let's say, 6 people on the line and they're maintaining distance. They would usually go and all have break and lunch together. We'll start staggering them at 15 and 30-minute intervals so that they're eating alone, and therefore we're reducing that risk. Obviously, more employees that can work from home are better. And we were a company that was having meetings consistently. Everybody knows and believes that communication is the key for business. But in these times, we've just completely eliminated our meetings, or even having our Zoom meetings within our own company, which is weird, but it works really, really good for separation. The next test that I want to talk to you guys about is sanitation. Obviously, being underneath the FDA umbrella, we take responsibility of sanitizing our entire room on a daily basis, usually after production. We've now started doing mid-shift and break cleaning. So we've gone from a frequency of cleaning once every 24 hours to cleaning 3 or 4 times. As well, when possible, we've shifted people from first shift to second shift, just so that those actions aren't happening on the same shift and we have even further separation.
Just add, Charlie, do you mind if I just add something to that? I think it's not it's not just about, obviously, the amount of cleanliness is going to enable us to stop the spread of bacteria. It's also about instilling confidence into the people that work for you. So ultimately, one of the questions raised before was people may be worried about coming in, taking the infection home with them. While social distancing has been quite prevalent, a lot of our staff have children of school age, so people are quite conscious of not being out and bringing any viruses home. So I think, yes, there's the level of cleanliness that we want to all keep by doing sanitation twice during shifts, but at the same time, it makes everybody in the environment feel a lot more confident about coming in and working for you, and then going home knowing that you've done everything that you possibly can. So part of it is to prevent, obviously, the spread of any bacteria, and the other part of it is just really to instill a great deal of confidence into the people that work for you, so they want to continue to come into the building and obviously earn money.
Yeah, everybody, when we returned to work, everybody was, the first day or two, I'm sure some of you guys are going to experience this or have already, everybody's very skittish of each other. They don't want to even get near each other. There's a lot of practices that you need to install quickly to maintain that confidence. Another piece that we did is if you have uniforms or anything that is repetitively worn by your employees, we increase the temperature that our third-party company and us internally are sanitizing at to have a better efficacy on killing any bacteria or any pathogens, any holding areas. We also did a physical scrubbing of our lines with chemicals, and then we've also moved to fogging to be able to get into nooks and crannies and different areas that we may think is clean, but it isn't. we switched the way that we enter rooms. You've seen it at your local Publix, I'm sure. They start having you going one way down the aisle. We have that same approach now in our production facility. So it's just keeping the flow of traffic the same so people aren't crossing each other. And then I think it's also important to do a change of chemicals over time as well, because some of these things can build a resistance. And lastly is the safety piece. We have a lot of foot traffic of people coming in, so installing a UV pad for people to step across so that it has a kill on the bottom of their shoes. We already had a glove and face application, so now we're starting to change those out faster, as well as some of those items come in and we don't know where they're coming from, but yet the employees put them on their hands and face, so we're sterilizing those. Increasing the frequency of bathrooms being used and entryways being cleaned. And we already had quite a few items in our facility that were hands-free. Let's say, for example, when washing our hands, you would just press a button with your foot. And so we're working on having that applied to almost everything we do in our business. And then lastly, some of our prevention in 2020, we want to start making sure we have positive air pressure in all of our rooms. Therefore, as soon as you come into the facility, it already has a positive airflow pressure against you. So anything that's clinging to your clothes will be blown into the room that you were in last. We're looking to test air quality and water quality. All of our foreign-based items that we receive, because we do receive things from other countries, we're washing and sanitizing those even further and analyzing how that's handled. And visitor and suppliers. This is a big one, I think. A lot of people believe that they need to see visitors or customers or suppliers. I think this is obviously a time that's a big no-no. So we've denied anybody from coming and visiting our plant. It's literally just the employees, not even family members. So it's really restricted down to that. And I think another thing that we can look at down the road would be UV lighting installed in the return ductwork. We don't really know how that's going to have any, damaging result on COVID or anything further, but we do know that it works on other bacteria and pathogens that are airborne.
Should we open it up to any questions? Thanks, Charlie. Should we open it up to any questions anybody may have?
Definitely.
The only question that has come in asks, does the CDC require recording temperature checks?
We'd have to refer to the CDC website. Right now, like I said, our approach is we do a physical inspection of people coming in. I think it's also really good to have a great line of communication with your employees, asking them if they've had anybody in the family sick, how they've been feeling. Like I said from the very beginning, there isn't a great playbook for this right now. We're also under the impression too, with everything that we know today, that we could take the temperature reading of an employee with them potentially having a higher temperature, which would be an indicator of COVID, but they could also be carrying it without showing the fever. So for us personally, we're preventing as much as we can of anybody coming to the plant, but more of our duty now that we're turning our eyes on is preventing contamination while people are in the facility. I think it's impossible for anybody to say that they are going to create an ambient in which they can prove that nobody is coming into their facility without it. I think the only people that could say that are people that are closed.
And James and Charlie and Daniel, to that question, and correct me if I'm wrong, but I believe that the doctors, when we provided our final set of recommendations, guidelines, said take that out. They didn't think that was reliable enough. And I think that they actually are going to take that out, if I remember correctly.
I think it's been somewhat of a moving target at the beginning of this process. As you might remember, they were only testing people that had positive signs and temperatures, and we've now realized just in the past few weeks that there's a large percentage of the population that might have the virus and have no symptoms at all. Obviously, no temperature. Yeah. So while temperature taking might be something you would feel is important for your organization or for your team, it doesn't necessarily capture everybody who is potentially infected with the virus.
Yeah. And James, and this is for the group, at the end of the presentation today, there's a link to the CDC guidelines. It's really almost to their homepage that covers all business and workplace. So I'm sure, and I think that gets updated probably daily almost, but whenever they update it, gets updated quite frequently. So there might be some guidance in there. But something for the group, when we were developing these guidelines, we had put in there, take temperature, no touch, but I think the doctors recommended take it out. But other stuff that we recommended, ask questions related to travel, risk conditions, any external exposures, document observations by staff of everybody that enters the building. This is employee and visitors. The screening process, whatever a company decides to put in place, should occur daily. In the actual set of guidelines, Vista Color. So Hess Hernandez gave us a sample form of what they've done. And Hess, I probably know the answer, but I'll just ask it anyways for permission. But would you be okay with us sharing your form with the group on what you all have been doing to screen? I'm sure you're going to touch on it when it gets to your part, but just want to make sure you're okay with that.
Okay, and we have one more question for Charlie and Daniel. Did you have any employees rejecting these new conditions? How did you handle this?
So the first part, we didn't. Luckily enough, we didn't. Like I said, when everybody came back to work, right after we had sent people away, you couldn't believe how much there was almost like a family knit community out of everybody that came back to work. Everybody was very sensitive to things. They're very responsive to anything that was going to get them back to work. About a month ago, there was a survey that was done that I personally read that went down the checklist of what was most important and most feared by Americans with COVID. And three out of every four people were not worried about the sickness. They were worried about their financial situation. And so the employees right now, we felt, and we're seeing that greatly, are much more responsible financially than maybe even to COVID. And so therefore, them being able to come back to work and follow the guidelines and the rules was, they were very, very compliant. Also, they, like Daniel mentioned earlier, they knew as well with us stepping up and increasing the frequency of sanitation, installing all these new rules, it made them feel better about where they were. And so we didn't have any rejection, and I don't foresee any, but time will tell. We have to keep on top of our procedures and our policies and our trainings. And until there's a vaccine that's made, we won't be able to tolerate anybody deviating from the norm.
One thing I would add is I really recommend logbooks at the entry points of the building. You want to know who's coming in and out of the building. They're going to have to sign, as you're going to see from Hess, some sort of form saying that they haven't traveled to areas that are more infected, or that they don't have anybody at home that has COVID. And it just creates a discipline at your entry point. And then if there is ever an outbreak, you have the documentation to be able to provide for traceability. Everybody's going to know who's come in and out of your building. And it just gives people a sense of discipline that you're actually acting like a proper business. You're acting like a business that really is going to behave in a way to protect its staff and to protect anybody coming in and out, and ultimately its customers. So I think those disciplines are really important. I would highly recommend logbooks of everybody that comes in and out of the building for traceability.
Very good.
I have had a lot of interaction with my employees in reference to protection. At the beginning, they did not understand how easy the virus on touch-up points can be transmitted. Example, the microwave, refrigerator points, the timing clock. Charles, what we did, I did have that concern of you, or that you placed one employee to disinfect the time clock between each employees. So what we did, we follow a little bit of Jess Hernandez's advice, and we have secured biometric time clocks through ICE or through fobs. All our employees have a fob, and I prefer the fob, so they need to be using the fob. As to the scaredness of the employees being scared and the money situation, at the beginning, we've had like a 40% missing employees that did not come to work. That has been reduced considerably. but we are still finding that most of the employees that have children in school, and we have one that has a 15-year-old children, a very small baby, she's not coming to work because the government is paying them. So most of those employees that can get money from the federal government will not come to work. They'll stay home, or I don't know what they will do. They do not need to come, so they're not coming. About 90% of our absenteeism is from this. Then there is about a 10% of the absentees that are just simply too afraid to come to work. And the excuse is that they have an elderly person, their mother at home, and they don't want to expose the elderly person. So they refuse to come in. The rest of the employees, I have talked to them. I have teach them how easy the virus can be transmitted. And in the most part, they are grateful for me as a president talking to them and sharing our concerns and teaching them not only on how to take care of themselves in my plant, but also once they leave the factory. I have gone with them on each procedure when they come into the building and they leave the building, how important it is for them to disinfect with anti-gel, antibacterial soap. So they do appreciate us having this conversation, and for them to understand that we care for them. That has gone a long way for my employees.
Great. Thank you, Luis and Charles, Daniel, for that update. I know there might even be a question or two in addition, but why don't we hold those till the end? We'll save a few minutes at the end for general questions, but I do want to move into the third part of the program. This is where we cover best practices. Hess Hernandez of Vistacolor, Vincent Fuster from Diaplast. I was very impressed by both these gentlemen as we began this process a few weeks back. They had already developed some very specific plans, highly detailed, for how they were managing the safety of their employees, and much of that information was the foundation for these recommendations. There was already a mention of some of that documentation that by Matthew that could be shared after the fact. But I welcome Hess and Vincent to share some thoughts on best practices that they've employed into their facilities, and then again we'll keep a good maybe 10 plus minutes at the end for some further Q&A. Hess?
All right. Well, good morning, everybody. Welcome to what I've been calling our adaptive recovery, because the truth is that we're finding that every week there's new information. So it's very critical to be involved as those are online leadership roles, to seek information outside of within each of your segments. We're members of many other organizations, and I've been attending a lot of different town halls about the economy and everything else. And it's important to get good data. CDC is the best. We've given information to tell folks not to go with what they hear, and particularly not local news or anything else like that to a degree. Follow the guidelines. I think will keep us well. Also, I wanted to say we were involved, and thank you to all the group that was in our team for manufacturing, and by the invitation of the mayor. It was quite the opportunity and learning experience for myself and everyone else. And there's sort of so much validation to be able to see that other companies are doing something that helps the community and helps each company. And at the end, our employees to stay safe and stay focused, which is really what we need to do right now. There's a lot of mental anguish besides the other seen threats that we need to deal with to a certain degree. But I also want to say on the manufacturing side, we are unique and we have an opportunity. We're fortunate actually, because as manufacturers, we can control the access of our building and our facilities more than most. Unlike those that are in the restaurant business, the hotel business, they have some very unique challenges, but we have opportunities to control the access to our buildings. And since we're in manufacturing, we're all in process control, process review, process implementation. This is just another process. So for us, it was just in our nature, since we're mostly dealing with project management, to roll out a lot of this. So the first thing we did is we created a leadership team. We have on board a safety compliance person that 10 years of experience in a hospital, And he helped create this team, which is critical to whoever comes back to have a point person in your organization, no matter what size it is, that's going to have the answers or respond to any concerns or questions. And then, of course, it comes along with publishing data, publishing the information, put posters up, and all of the above. Give you a little background before we go on. I just want to do the opening. Vistacolor is a folding carton manufacturer in the Doral area, established in '68. I've been here for 38 years. I'm still here. Learned a lot, seen a lot, very fortunate. So what we're doing is folding cartons, paper folding boxes for the many industries, particularly pharma and food. So we've already put a lot of the GMP processes in place to run production, but also to be able to keep our operation in compliance. And now adding this COVID safety has been simple. Our plant is in Doral, like I said, it's 75,000 square feet. We have 116 employees. We run 24/5, sometimes Saturdays as necessary. When this first came out, and this is part of the adaptive recovery, that we heard that our area was going to go into a lockdown, we printed the information that Miami-Dade printed out of our category as an essential business. We gave letters to our employees. They still have it since we run 24 hours. And they want, in case they got stopped or whatever, didn't really occur, thank God. But we went and we were proactive to that and issued some IDs. They wore the Vistacolor uniforms, not been an issue at all. But I just wanted to know the group that was very helpful. One of the things that that we learned, or I learned from this manufacturing thing, that you've seen in some of these presentations, is how to put your strategy together as preventive, preparedness, and responsive. I think that may help you guys take some of this data that we're going to throw out there, and it's a lot of points, and we were conscious of the fact that not every company was the same size with the same challenges. So from that, you can take some of these points, there are the recommendations, and you can make some modifications. We did, our plant does work out that we have a single point entry, and that's been very effective for us. So everyone comes in and out of one area. We do a screening. We take everyone's temperature. We've been hearing pros and cons. We're going to do it. We've stopped 2 people that came in with a fever, sent them home. If you don't pass the test, you have no access to our plant. And thank God it wasn't COVID, but that helped a lot. I also want to state that for us, and this is just unique, we did a pause and continue. We never closed down, but we stopped our plant for 2.5 days, and we had every employee tested. And then we reopened as each employee got their negative. Fortunately, everyone was negative. And then we lit up our plant again. That created a baseline, and that created a sense of community and protectiveness that the employees really appreciated, all of us, me included, to be able to start our plant again and be more protective that anyone coming in with a threat, or not a threat, but COVID would be more careful to protect that baseline. And that was a big point. In our entry process, like I said, we provide face masks to everyone that comes in. We have the shoe cleaning station. We provide the hand sanitizers. We actually give everyone in the plant a hand sanitizer. They don't put their name on it. We wear wristbands after you get your screening. Everyone in the plant has to have the wristband. And that's been very helpful too. We caught one vendor that snuck in, and they sent them out. We did the testing. Fortunately, nothing happened. We do wear face masks all the time. And someone had asked a question about how do we keep the safe distances. We've actually designated floor areas for operators to try to stay in those areas. In the lunchroom, we put X's in some of the tables, chairs, so because we have like bench seating, picnic table type of stuff in our lunchroom and outside, so that we know people should be sitting there. So that was a big helpful part. We eliminated all the touch points. We got rid of the time clock. We had a biometric. We are actually, by the way, if you're going to go there, ADP is like 4 weeks behind to do facial recognition. In the meantime, we just made it simple. We gave everybody 40 hours, and we're just taking in overtime. And it's been working fine. Well, we documented, of course. But sometimes you need simple solutions to what could be a complex problem. So that's all part, once again, of our leadership team, throwing in all of these issues and concerns that we've had. Visitors, we basically shut the plant down. Only folks that need to come to our plant come in. We try to make a reservation. They have a handler. And I also want to say that we've been in this operational mode for 5 weeks now, following these guidelines, which are very similar to the guidelines that we came up with the group. And like I said, feel free to make some of them more specific as needed. And so far, so good. Now, in that preparation point, like we said, we prepared the building. We also took into consideration a responsive consideration. If somebody is going to test positive, well, we have a process for that. We're going to, try to track what they're doing in some simply designated areas, which we've also told folks where they should be. We have cameras. We can go back and see if anybody was in the area. We haven't had to do it yet, but we can. And then send that person off to testing and everyone else to test, and then bring them back as needed or necessary after the 14-day classification as it stands now. And once again, I think the group said it. Please go to cdc.gov and follow a lot of the recommendations if you have any doubt, because that's changing too. And I think that's critical to keep everybody in focus on all that. And again, the messaging through the plant, posters, the managers enforcing. We're almost like chaperones in a junior high dance sometimes. We're like, okay, guys, because human nature is we're built to communicate. We're built to talk to each other. And that's been a challenge here. I've tried to say, okay, stay in your area, talk less, talk lower, challenge, but it's working. And that's been a big plus, I think, so far. Information we have, we can give you if you have any questions or any comments on some of our process. We're willing to share and get everybody involved if necessary.
All right, good morning. This is Vincent Fuster with That Plus Products here in Opa-locka, Florida. First of all, I want to say it's an honor to work side by side with this group of people and you all. I think just like Hess and other members have expressed, it's been very educational, and in going through these processes and see what our peers are doing, and what we can take away from all this practices. DiPlus Products has been around for over 60 years in Miami. And we are one of those companies who, through this pandemic, we didn't have the luxury to shut down. So we've been remained operational since this all started. And I want to say that two things are key in all this: leadership, which we've you have heard throughout this session that it's key. The other important thing is communication. Communication will actually solve a lot of these questions that has been posted here. How do you ensure that social distancing is it's followed? You talk to your employees. You designate a person who's in charge of making sure that all these guidelines are being followed. Incorporate that into your employee handbook. Yes, there is a lot of policing around here, but that's the nature of the beast, right? These are unusual times, and we need unusual measures. And in that respect, we had to start by ourselves down here to change business practices. How do we attack our business now that it's not business as usual? How do we attend our customers? Do we do them based on the order of priority? We are a manufacturing company and we produce foam. So it is important in the manufacturing industry. Well, we provide construction materials for hospitals. Actually, we have about 4 to 5 different under construction or expanding, and that's critical. Same thing with schools. Same thing with mobile medical structures. That's all they do. One of their business segments is making what they call the forts. the sports are small hospitals that can attend people. They are very busy nowadays, as you can imagine, and not only locally in South Florida or nationally, but they're sending these units worldwide. So that's why we were not able to shut down or pause for some period of time. And that's why we needed to maintain and make sure that all the guidelines have been followed. Someone is key. We have a safety coordinator. The only thing that is to
Vincent, I'm so sorry to interrupt, and I think I'm getting some feedback. I don't know if others are having difficulty hearing you, but just in the last minute or so, you started to break up. So I don't know if you could, if there's anything that changed with your microphone, or if it's just a connectivity.
I don't see anything. I don't know.
We heard you loud and clear up until about 30 seconds or so ago. And I'm seeing some.
Sounds better.
So he needs to do something, right?
Let me see.
Apologies to interrupt you. I want to make sure we hear what you're sharing with us.
Well, do we want to maybe field some questions until we can get the sound resolved?
Vincent, why don't you take a look at your microphone and maybe we can address some of these questions.
Yeah, I think
Caitlin.
on one of the HIPAA question, I asked that question on one of the calls also. The doctors that were on the call said that, you know, if you're doing screening, which is the questionnaire, and yes, this is not perfect. It's not going to catch everything because 60 to 70% of the people that have this do not present any symptoms. But it's the same thing that happens when you go to a country and you get a screening and you have to answer questions about whether have you been exposed, have you gone, do you have a fever, do you have a cough, etc. According to the doctors, it has an impact. Just the fact that you ask those questions has an impact in reducing spread. The other thing that they mentioned is that even having signs up, and I've seen this in several places, just having signs outside of your entryways that say, please do not enter if you are not feeling well, and there's like different languages for those. Even just the sign has an impact on reducing spread. And this is what the epidemiologists were telling us. It's not perfect, but it's not a HIPAA violation to ask these questions. And it does have an effect in reducing spread.
Very good. Caitlin, do you have any of these questions, or I can pick some from the
there
chat?
are a couple that came in. Have you identified any employees that have already had COVID, and as such, can they wear a badge, and at that point, no mask is needed?
Whenever we have an employee that has tested positive, he cannot come to work until he goes immediately to the doctor, and cannot come to work until he has been cleared by a doctor in black and white on a document. That means that he must have passed a negative test. That documentation is needed before he can come back. If at entry point, an employee, when we take temperature, shows a high temperature and or has symptoms that can be visually been seen, he is not allowed to come to work. He has to go home. Anyone with a flu or anything like that has to go home. They're not allowed into the building.
Great, thank you. And one last question, is there a method or procedure for employees to express concerns?
We talk to them constantly and allow them the opportunity to participate in the group meetings and training, so that we can take into consideration any suggestions that they may have that are always welcome. Two heads think more than one head. So the employees' input is always a positive input, especially making them feel part of the process.
Yeah, same thing for us. Constant communication is part of our, process anyways, 6 feet apart now, of course. We have made weekly announcements of any changes and compliance, and then we also tell them and ask them to share with us if they have any concerns, and specifically COVID-wise, if someone's ill, someone in the family traveled. I kind of went over my part pretty quick, but yeah, the question, the employees or the staff, everyone here is very grateful, like I said, and they are compliant. No one's giving us any grief at all. They understand this is not something created by our company or our country or anything like that. It's basically, this is bottom line, taking care of each other. So they know this part, and I think they're communicating that well, and nobody wants to get sick, but if they are, we have those procedures to try to isolate it. And that's the other part, keep everyone in your area, because God forbid someone does get this, you don't have to shut your entire plant down again. So you just work, and this is a recommendation from our manufacturing doctor. If you keep people in their areas and somebody, God forbid, gets it, you can just deal with that section of your company as a manufacturer. And so they know that too, so they've been quite compliant. And we also wanted to say we shut down the water fountains, the vending machines, we chased away the lonchero. All these things we're trying to control. They sound basic, but they're very important. And we encourage folks to bring in their water and their snacks.
Sorry, I think I'm back. Can you hear me okay?
Yes, much better.
Got it.
All right. Sorry
Thank you,
about that. My microphone went dead all of a sudden, and it couldn't even test it. So I don't want to overlap on some of the things that Hess mentioned, and I think pretty much everything has been said, and a lot of time has been wasted. So I mean, on my end, I'm sorry. So when we established this plan, this was late January, well before all the frenzy started to come around. We saw it coming, but that's the importance of having someone dedicated to do this. And I understand that not every company can do this because there's a lot of small manufacturers out there. But as finding someone who is responsible to incorporate this as part of the emergency response plan is key, right? I'm not saying that we will see this more often. I'm not a doctor, I'm not qualified to say any of that. But just in case something like this hits us again, we need to make sure how to respond. So how do we respond? Again, we needed to change our business practices. We needed to, for example, reduce the number of workers available or attending at a time. And we have between both buildings, we have about 100,000 square feet of space, and we have just about 50 employees out in the manufacturing plant. So we can create social distancing. But even when we have that much space with that little people, we wanted to mitigate this even further. So we created additional shifts. We extended our labor hours. Now, instead of working 5 days a week, we work 7 days a week. And we basically spread them out into 3 shifts, right? So all these things, little by little, they help, and then obviously they come up to a whole sum of things. Other things that we've done is restrict all of the preventive maintenance. Vendors coming out on a regular basis, unless it's strictly necessary, we will not allow anyone to come in our plant. Single points of entry, of access. We talked about during our little session to present to the Miami-Dade County panel, and that's also key. Time clocks. We've heard a few things about time clocks. I mean, face recognition is great. Not everyone can afford it, right? So we assign one person to actually clock in and out the employees. So that's only one person handling all the cards to swipe. They sanitize several times a day, not only their workstations, the common areas, limit people in the bathrooms, on the lunch, the break room, I should say. We actually made tables out of foam so we can spread out our workforce throughout the outside. We created little chairs out of foam so we can, limit the guys to be only 2 to a table. We have to stagger the breaks. Only a certain amount of employees are allowed to go at the same time. So all these things, little by little, they start, like I said, adding up. Meetings such as this, no gathering in the same room as much as possible, right? No travels. We covered not only South Florida, we covered anywhere from Alaska down to Chile in South America, from New Zealand to Dominican Republic in the Caribbean. So no traveling is allowed. Our president and CEO, he commutes every week from Birmingham, Alabama, down to Miami. He hasn't been in Miami for 2.5 months. So those things, again, they start adding up. But to close it, to close this out, I'm sorry. Communication. Talk to your employees at all times. We have daily meetings per shift. At the beginning of each shift, you talk to the employees, and you keep repeating the same thing over and over again. Wash your hands. Use your masks. We're providing all this for our employees. There are resources available to us out there. Let's utilize those resources and let's implement this. And now I leave it open to any questions. And again, thank you very much for allowing me to have this opportunity to talk to you all.
Vincent, thank you so much, and I'm glad we got your microphone fixed so you could share those final thoughts with us. We're actually going to move over into the closing over to Matthew for the few remaining minutes we have. I do want to thank all of our panelists for being part of this, and I found it very interesting, just the discussion of some very low-tech solutions, just simply keeping folks apart, high-tech solutions from UV lights to clean your shoes and others, and everything in between. I think that's very important as this conversation and these rules that were developed, really trying to overlay, as you said, not just all Miami-Dade manufacturers, but this could really be applied anywhere in Florida, in the country, or globally, theoretically. And so how a company of any size could interpret and apply these recommendations to keep their business operational and their employees healthy. I think it's been a great conversation. So again, thank you. It was a pleasure to be part of this, and back over to you, Matthew, to close us out.
James, thank you so much, and thank you for moderating this today, moving us along, filling some questions, asking some questions. And you're correct, a lot of great information presented today, and we want to thank everybody. And James, thank you for you and the Beacon Council and your good partnership with us. Great resource for many of our, not only manufacturers, but many of our companies in Miami-Dade County. So thank you for all that you do. We have a special guest, kind of an audible this morning, that not even James knew about until a few minutes ago. We found out about it yesterday, kind of kept it secret, but there's been a lot of questions surfacing around testing and having employees tested, and where do we go? How do we get that? And largely, there was not a good answer by anybody, really, for companies. But I think we may be moving the ball a little bit, and I'm going to let Jay Hess take it from here. Jay was able to locate a potential resource for us. So Jay, the time is yours.
Okay, good morning, everyone. I gotta say, I'm quite fortunate to have so many good CEOs and leaders working with me. Can't do it without you guys. Thank you. A couple things have come up. I heard loud and clear from this team and others regarding testing, or serology testing, if you want to be technical. And I had made some contacts and some communications. Some came to me, some I initiated. But I will tell you that there is, as of at least my understanding as of last night, there still is not an approved FDA serology test that can be administered, within your plants without a laboratory at this point in time. So started poking around with that, and I will tell you that there is one that was out on the market that was seeking FDA approvals from Becton Dixon. They had offered to work with us as a major corporation, by the way, to work with us in providing serology testing for manufacturers under certain circumstances. And as of last night, no kidding, they withdrew their product from the market. So this is a fluid environment in terms of testing and the viability of this testing. Their materials went into the FDA on the 16th of March. They began distributing those materials somewhere around the 20th of March. And as of, May 8th or May 7th, if you will, they have stopped allowing those goods outside of their factory. So I'm not sure why. They just told me they are going to wait until they get FDA testing to move any further down that line. However, I think the good news is that there are people actively looking at this problem. They are trying to come up with tests that are reliable and can be self-administered or administered through one individual. In fact, they had some practices that I was going to communicate with you about how these tests have to be administered. But in light of me being a non-medical professional from this point of view, I had also had the opportunity to speak to a local physician and actually the VP of Biopharma and Research and Development for Division 5 Labs. I'm going to introduce you to Dr. Tehar Binder, who is on the line with us today. He will introduce the idea of serology testing, maybe some of those limitations, and actually his company is one of the companies developing serology testing, and he happens to be developing it right in our backyard. Dr. Binder.
Good morning, everyone. Thank you, Jay, for inviting me to be a part of this call. As we're all aware, we're in very trying times right now. Let me just give a little bit of a background about myself and my company, Division 5 Labs. So I'm a physician by trade, and I'm the VP of Biopharma Research and Development for Division 5 Labs, which is a South Florida-based pharmaceutical distribution company. We have a manufacturing wing that is an independent CDMO, Contract Development Manufacturing Organization. We focus on the development, manufacture, and life cycle management of products for the pharmaceutical, medical device, and diagnostic and clinical industries. Our manufacturing site is FDA registered and ISO certified, allowing us to complete projects at any stage of the development cycle. So in light of the current COVID-19 pandemic, we are addressing this pandemic from every angle, whether it be test kit development, whether it be mass producing vaccines, which are going to be, which are undergoing trials right now, and even medications, that are in shortage, such as azithromycin or things of that nature. So on the front of test kits, we are currently developing our own test kits, which are going to be manufactured in our South Florida-based manufacturing facility. And of course, things which are made in the United States are of a higher caliber, higher quality. They undergo those stringent quality control procedures to be able to be very competitive versus tests produced outside the country, whether it be in Europe or in Asia, for instance. And so we are in the process of developing our own test kits. However, in the interim period, we do work with several companies who have test kits, and these test kits are, of course, FDA approved through the emergency use authorization, and we only work with test kits that have a very high level of sensitivity and specificity, around 97 to 98%. And in this time, there is a lot of uncertainty, and a lot of employers and employees about, returning back to work and to the workforce, etc. So testing is a very important component of that. And, it's of course very important to have a good quality test available so that you can be secure about the validity of the results. There's a lot of tests, a lot of companies, popping up, making these test kits, and selling them, but they're unfortunately garbage at the end of the day, and the validity is very poor. We have been fortunate to test a number of different test kits from a number of different companies from Europe, from Asia, etc., on live COVID patients here in our hospitals in South Florida, and the results were very poor, to say the least. When compared to PCR results. However, during this time we were able to identify some very reliable test kits that did have very good sensitivity and specificity levels. And so obviously those are the test kits we work with at this time until our test kits are developed in the next several weeks. And this is the rapid serology test kit I'm referring to, the one where you take a finger prick blood sample, you apply it to the cassette, you put a drop of buffer solution, and you wait 15 minutes to see, whether the patient tests positive for COVID or not through the IgM, antibodies.
So Dr. Bender, do you see for the application of these tests within manufacturing, specifically the serology testing that we're speaking to, we know that, the day you test it and the results you get, assuming good, doesn't necessarily hold true for the balance of the week, right? We do understand the moment and the value of the moment in that, but do you see these tests being applied by people within manufacturing? Would you see the limitations on these tests as the ones, particularly the ones that you're developing? Do you see any restrictions to manufacturers being able to perform these tests themselves?
I think it's very important that we test people, and that's something that's lacking in our country, unfortunately. Due to the vastness of our country and the bottleneck in the supply chain with good quality test kits. Yes, it is, but it's always good to establish a baseline with your employees and with your patients. And periodic testing is also something that's good, along with the standard operating procedures that each particular company has in regards to how they're addressing the COVID-19 pandemic. Social distancing practices, questionnaires, checking temperatures at the door, all those things, while they may seem minuscule, they do have an impact, and they do make a difference in the overall grand scheme of things.
Okay. Well, thank you very much, Doctor. We appreciate you coming in today. I know it was short notice. I hope the group understands that we are addressing the needs for the testing, and we'll be back to you shortly as we develop a pipeline for the availability of these tests.
Jay, thank you so much. And again, just to close it out in the next minute or two, again, the skeleton outline, we're going to send everybody the full guidelines that were created, along with the form that's included in that from Vistacolor in terms of questionnaire on what they're asking their entrants, visitors and employees both. When you receive the PowerPoint presentation today, you'll have the link. This is the CDC link I was talking about, kind of the comprehensive site. So you'll have that, and that should change probably daily, I'm sure, whenever they change up different parameters. Something that SFMA, Florida makes, and a regional approach between the Beacon Council, the Greater Fort Lauderdale Alliance, and the Business Development Board in Palm Beach, along with the South Florida Hospital and Healthcare Association, is trying to create a catalog which will show for South Florida who's making which critical needed product, whether it's a face shield, mask, hand sanitizers, UV chambers, whatever it might be for your facility and others. So we've come up with a vetted supplier catalog. You'll see that. This too will be updated as we get more information and that comes to us on who are, whether it's a supplier or a manufacturer that's creating these products down here, like Demitech. We've heard Vistacolor actually is doing face shields, I believe. Tucci's doing face masks. You'll see the companies that are in this catalog. I'm going to show you what it looks like, but we will, let me pull it up for you. We'll see here what we're referring to, and we'll send it to you as well. Bear with me one second. Where did it go?
So Matt, the availability of this catalog is what?
It's now. So I don't know where it went to. It was, well, maybe there it is. It's hiding on me. Can you all see this?
Yes.
Okay. So the availability of the catalog is now, which we're going to send out. There'll probably be a few more products added to this. I came across something just this morning that we'll need to vet, but as we go, we'll add. And this is our program partners. Shows the table of contents. We divide it into personal protective equipment, masks, hand sanitizers, and then facility equipment. So all of that is here, organized. Who's doing what, contact information, any information about the product that we were given. But again, the intent was really for us to provide you with information on where to go. You need face masks. Well, let's see who's doing it in South Florida. All right, I like Fruitful. Or I like Demetec. Let me reach out to them. That's the intent of this. And Jay and Micah, who also is our business advisor, can attest that when we come across somebody that's claiming they can do something, they're vetted. And they don't go into this catalog unless they've been vetted. That we know it's legit, that it's not coming from who knows where, that it's quality. And that was the intent of it. And really it's for you. We're not guaranteeing any price or quantity because that could change. So that's basically dictated, upon what is there that day. And we're not endorsing one company over another. We're giving you the opportunity to see who you like, contact them all if you like, and make the best informed decision. But this is here. As you can see, there's a UV disinfectant chamber, and there's other things in here. Sneeze guard, so if you need to put up dividers on anything or have other sneeze guards, that's in here. So it's what we have at this point. Jay and Micah can attest. The amount of companies that they vetted versus what's in here is strikingly different. A lot of folks claim they can do certain things and they really can't, or they're not really applicable. So that's what is coming. So you'll have this. Something else, and Jay, I don't know if you want to touch on it for a minute, but this is not the end of our quest in helping our members. I mentioned at the beginning we're doing a recovery phase, kind of phase and approach. This was the first launch of it, if you want to call it. Our intent is to do something hopefully weekly for you all. Jay and I and a few others are working on what stages and what needs to go into a recovery stage for manufacturer and which partners we have, like our folks here today, that could be of a resource, and whether it's sending out information, having webinars like this that we had today, to educate you all on certain things. Jay, anything you want to add to our phased-in approach? I know it's still kind of under development, but we hope to have a final.
The only explanation would be that these phases will increasingly get deeper and deeper into your business and the considerations of what a new norm will look like for your business. Some, if not many, of the businesses don't necessarily have the same customer base going forward. There's a potential there. Yesterday we did the seminar on bankruptcy. That is part of understanding how to deal with what may be fallout from your business. If you've been closed, you may find some of your customers, you may find some of your suppliers bankrupt at these point in times. I hope not, but that's a potential. So we will be looking at elements and dividing those elements into snippets or webinars and making sure that there is some founded and professional information available to you on each of them.
Great, thank you, Jay. And again, thank you everybody for attending today. Thank you to our panelists. Thank you very much to our moderator, keeping us on track. And the next steps, so I'll give Caitlin Santonzi all the information that you'll need from today's presentation. Any questions that did not get answered, that were asked, we will have a answer for you, and we will send you that in writing. So rest assured your question will not go unanswered. But we wish you a great rest of the day. Good weekend. Hope you, your family, your employees remain safe, and we will get through this together as a family. Thank you very much, everybody.